If you're someone who has experienced a lot of joint pain, whether that's shoulder pain, knee pain, or you've found that the soles of your feet are aching and certainly your ankles are aching, then I want you to love your carotenoids. Now, the carotenoids are, they demonstrate a variety of health benefits, but the one that I'm really focused on is the fact that they help you to reduce inflammation in your joints and they help improve your aching muscles. So I want you to be thinking about orange. I want you to be thinking about pumpkin and carrots and yams. And these are going to go into a soup that I'm going to make a little bit later. I've got a beautiful pumpkin soup. It's a very old recipe that's in my recipe book for the My Menopause Transformation programs. And the reason I have that in there is because the beta carotenes, these orange carotenoids, are now known, they've now been proven to reduce inflammation. They've also been proven to help reduce the risk of cancer, and for those women at risk of breast cancer, especially if you're in your post-menopause years, then this is really, really important to understand these wonderful nutrients and the benefits of specific nutrients that are going to reduce inflammation and reduce your risk of cancer. So the other thing is with carotenoids and, these beautiful orange, they're called beta carotenes, is that not only do they help with their eyes, and we tend not to forget about our eyes, don't we? But I know that many of you are working in front of a computer, which I am as well. And of course, what we can do is we can prevent macular degeneration with having the right nutrients. So this is where pumpkins and pumpkin seed oil is often used in supplements for menopause. And you've got to think about, well, why is that? And it's because they contain certain compounds that contribute to reducing inflammation. And we know that the perimenopause to menopause to post-menopause years, they are a time of inflammatory changes in the body. As you move from perimenopause, when your periods end, into menopause, and then you go into post-menopause, and you're in post-menopause when your periods have ended for a year or more. And I'm really big on post-menopause. I'm in my post-menopause years now, been there for a long time. And it's, understanding these specific nutrients that I've researched that help to turn around the joints, that helps to turn around the skin, the aging of the skin, and certainly they help to replace the role of estrogen in a way that we need as we move into our post-menopause years. Because as we start to lose estrogen and progesterone, which is a normal part of our aging, then that can become inflammatory around the body. So we want these specific compounds in our foods that are going to reduce inflammation. And that's really the purpose of a lot of my nutrition that I have in all of my programs, but especially the program called Beyond Menopause, which is for my post-menopause ladies. I know that for women who complete the My Menopause Transformation Symptoms Quiz, over 70% report that they've got sore joints. So it really is an issue. I know that many women who come on my programs talk about these sore aching joints. I was the same, particularly my knees, and it really challenged me in terms of doing the exercise that I wanted to do, or just the recreational activity, the hiking, the skiing, the cycling. And I really didn't understand that it was such an important time of life to have beta carotenes, to start to get these beautiful carotenoids into our diet. They have been evidenced to help reduce aging and some of the diseases of aging, I should say. So it's such an important aspect of your diet to include these beautiful foods. So you can make a roast pumpkin, you can make pumpkin soup, you can add carrots to your dishes, and you can also add yams. There's knobbly little foods that are really fantastic and offer a lot of beta carotene as well. So those are the types of foods that can be really beneficial for you. And if you're in your 50s, 60s, 70s, then that's how you need to be thinking. You need to be thinking, what are the foods that I need, not the rest of my family, but what I need to help me to age well, to help me to become more active. There's so much emphasis these days on high protein diets and heavy weight training, but if you've got sore joints and you're not sleeping and you really don't, are finding that exercise is a problem for you, then you're not quite ready for that advanced type of exercise. What you need to do first is you need to sort out the inflammation, start to get the right nutrients in your diet, and hopefully you can come on board with me. So I've got all of this information in the programs, but certainly find ways with your nutrition, with your sleep, and certainly with the activity that you do, that you're starting to focus on reducing inflammation. I'm Dr. Wendy Sweet from My Menopause Transformation, and I've spent the last 10 years working with thousands of women around the world who are really exhausted. They're really struggling with a lot of their symptoms. Many are already on hormone replacement therapy, but when they get to their post-menopause years, they're finding that it just doesn't work anymore. But it's because they've lost time. They've lost time in changing their nutrition, and they're getting caught up in all of these different, the fasting, the high protein diets, but they're not getting to the root cause of their nutrition and certainly the ingredients that they need to help to reduce inflammation. So I hope you can visit the My Menopause Transformation website. If you're still in perimenopause and menopause, then listen to the masterclass on menopause. It's online for you, and it's got a lot of fantastic information for you. It's in 2 parts. An hour each is a webinar. You can listen as a podcast, and there's lots and lots of information on the website. There's articles. You can sign up to my newsletter, do the symptoms quiz. You'll get some videos from me explaining your results. And most importantly, I want you to really understand that your midlife years from 45 right through to 65 are an important time of your life. And they're an important time of your life because we want you to look forward. We want you to look forward towards your healthy aging years ahead of you. Menopause is the biological pathway or gateway to your aging years, to the next phase of your life, where you're going to be in a low hormonal environment. So what we want to do is we want to get ourselves ready for our health, improved health. We want to lengthen our lifespan, but in a healthy way. And we want to give our body the foods that it needs to reduce inflammation and certainly, help us feel better and help us age well. So I hope you can visit the My Menopause Transformation website, and you can get lots of information on there, as well as follow me on the various social media platforms as well.